most famous physical therapist on the internet.
Hi there, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
I agree. Today we're going to talk about how to heal bicep pain with massage. So this could be tendonitis, a tear, or a muscle strain. So we're talking about the bicep. The bicep actually has two heads. That's why the bi is in there. The long head attaches to the upper part of this fossa.
Right.
The supraglenoid fossa. The shorter head attaches to the coracoid process. They come together. They go all the way down the arm here, and they attach it to the radius.
Right. So the upper, they're deep. They're deep under the deltoids, pretty much. But, you know, this one, everyone can see this, where it comes down.
Yeah, we'll show you a test real quick.
Sure.
But, you can actually get pain up at the tendon where it attaches up here. You can get pain on the tendon where it attaches here. Or you could get pain in the muscle belly itself.
Right.
So we'll look at all three of those. Now, if you, the muscle, what it does, it flexes the elbow, but it also supinates.
Right.
So it turns your palm up.
Yep.
And that's important to know that, because if you're testing, in fact, you'd want to check both.
You bet.
But, you know, that's why a lot of people, when they do weights, they go like this.
Yep.
They actually throw the turn in there.
Well, it looks better, too.
Yeah, it looks better, too, right? All right, first thing, there's three grades of a tear, and grade 3 would be a complete avulsion, like it tore away from the bone.
Yeah, so talking about the tendon.
Yeah, and a way to show that, boy, your arm is red.
Yeah, that's because, that's why my skin is. I'm hypersensitive.
Okay. So anyway, we're going to do the hook test, where all you're going to do, you actually take your finger, and you can hook right on the lower part of the bicep. Now, if you're able to hook it, that means it's intact.
Sure.
If you can't hook it, it might mean that it's tore off.
If it's tore,
you're going to see a big bulge.
Yeah,
there.
your bicep is going to be all bulged up in your arm.
But it could be tore here, or it could also be tore here, or it could also be tore there.
And
so
I think it's more common
up here. By far. This is rare down here.
Right.
The other thing is, if you do see that bulge in there, it could be that you tore the tendon up here.
Yep.
Now, if you tore one of the tendons up here, the long head or the short head, they may not do surgery. That's going to be up to you. You can function with it. You got pretty good strength with it yet. If you tear this one down here, you're going to have surgery.
Yeah, you've got to get that reconnected. But you could just have the muscle strain or muscle fibers partially torn, micro tears, or some aggressive ones.
And generally, you're going to find point tenderness when you do that. And you might see bruising. You might see a dent there. You know, there's all sorts of things. Definitely hurts when you lose the arm.
Yeah.
So
if it's a minor one, you can just feel in there. You might feel a tender and a knotty area where it's all tightened up, trying to protect itself. And then that's time we're going to get to the massage.
Let's first talk about the massage for the tendons.
Sure.
If you do tendon here, you're going to go right over the tendon, find a tender spot. So Brad's up or lower, Brad's lower, and I'm up high on the bicep tendon here. I can actually feel right that I'm on it. Now, this might be a little difficult for you to know, but if you feel around, you should be able to find the tender spot.
Yeah, usually it'll be, if you go back and forth, you'll run into it.
Right.
Say, oh, there it is.
And you can use finger on top of finger or fingers side by side, and you're going to really rub in that area quite aggressively across the fibers. You're going to do it for like 30 seconds. If after 30 seconds it's getting worse, you stop.
Yeah.
And then you might have to ice, or by the way, I was just reading they're not recommending ice anymore.
Yeah, I've heard stories about that. Yeah.
So I don't know if we should either. We'll have to look into that. But anyway, you can let it calm down for a day, and then try it again. If you are able to do this, and after 30 seconds to a minute, it actually feels numb or kind of plateaued or better, then you keep doing it.
Right.
You're getting blood flow to the area. You're realigning the fibers. You're breaking up scar tissue. All those good things.
It's a good idea to put a pillow.
Yes. Keep
on
yourself
your lap.
supported.
That just takes the stress off it, and you're able to work it better. Just a little thing that makes a big difference. Oh yeah.
Sleep-ovation pillow, Brad.
Yep. Can't go wrong.
All right. So if it is not the tendons, it might be right in the muscle belly itself. That's probably more common. trying to show off for somebody and you're lifting something heavy.
The girls walk by. "Argh!"
Same thing. We're gonna have you start the same way, cross fiber
Yep.
massage, and you can go ahead and do the 30 seconds and see if it gets worse. And if it does, again, you're gonna hold off for a while. Now, the problem with cross fiber massage, as it's recommended, they're talking about 15 minutes or so, which is way too long on your fingertips.
That's not going to happen.
So you can do it throughout the day.
Mm-hmm.
You can do it 5 minutes here, 5 minutes there.
Right.
A better answer is to actually use a massage gun. We got quite an array of massage guns here, and you may want to watch our video how to choose the correct massage gun for
Right.
your pain, muscle relief,
Right.
all those
Depends
things.
on what, because you don't want to. You're not going to buy a massage gun and just use it on your
Right.
bicep. You're going to end up using it.
You'll use it
throughout.
all over.
Yeah,
right.
it's amazing because they really work well.
But this one, you could probably. I don't think you need the athletic one. This is the heavy duty one.
That's for big, strong people.
Yeah, it's big, strong people that have big muscles, or if you're going to use it on your thigh or your buttock.
Large
or your,
muscle mass.
Yeah, large calf muscles even.
Sure.
I use it on my calf a lot. But otherwise, you can go with even one of the smaller ones, the tiny ones here that we have.
These are much stronger than they look, and they're nice to hold on to if you have a grip
Yeah,
problem.
you can really
Yeah.
you apply good pressure with it. Now, you want to show Brad how you do the cross fiber with that?
Yep. So on all these guns, the head traverses or travels
Yeah.
back and forth.
It percusses.
Yep. So we're not going to go straight into that against the bone. That's going to hurt like crazy on the sore muscle. But we're going to get in there.
So he's going side
Yeah.
to side.
Side to side. If, let's say the strain was right here in the middle of the bicep.
Yeah, the fibers run this way,
There you
so
go.
he's going to cross the
Yep.
fibers.
And I've been using this myself on my infraspinatus tendon. Same concept there. I haven't actually injured my biceps for, I don't know if I ever have actually.
Well, I heard my calves are just sore. I've been working them, and God, we'll just sit here and take care
So
of
with
ourselves.
this, you can go longer than 5 minutes, but you'll know because it's going to start feeling numbish. It feels good. If
You
it
can
doesn't,
do the 15 minutes if you want to.
sure. But when you're done, it'll feel all tingly. It should feel good, and you can just tell you've worked it. It's relaxed.
The blood
flow.
perfused to the area.
Yep.
So
Yep.
if you're on a budget, this is really your man here. This is your massage gun because it doesn't work as well at transverse as far, but
It's
it
not
does
as-
enough,
Right.
and it's a very inexpensive one.
Actually, the price between this one and that one isn't that much. I don't
Right,
think.
the one that comes without a case, right?
Right.
Yeah.
Yeah. It comes with a box and
Comes
everything,
with a
but it
box,
doesn't
right.
have a fancy
These
case.
all come with different heads.
Yeah.
So you can try it.
That one in particular, if you're an older person,
Yeah.
or a real thin person, oftentimes that one's
this
adequate.
this one's plenty for you. So, all right, Brad.
Well, I don't even have an injury. My bicep feels quite a bit better. It just feels relaxed. It's good. It's better.
Why don't you get a tattoo, by the way?
I'm thinking about it, but
A tank. No, a bull. You'd be showing
Oh
right
yeah!
There
Wow. Put one right across my whole chest, maybe.
bull. All right. Thanks for
My
watching.
wife would kill me.
Oh, God.